Hello, and thank you for tuning in today. The topic we are going to be discussing is a topic that has come up frequently inside my MSing Link accountability group recently. And it's a topic that a lot of other members are participating in and sharing their thoughts and their experiences. And I thought it would be really helpful to have a podcast episode where we talk about switching medications and basically when you should switch, what things you should consider, what things you should be on the lookout for. So today we're going to review those things as it pertains to disease modifying therapies, which are medications that you take to slow the progression of MS and reduce relapse rates, and supplements. So even if you're not taking a disease modifying therapy, if you are taking a supplement or considering taking a supplement, everything we're talking about today also applies. We're going to talk about examples of what those medications and supplements are, reasons for switching a medication, indicators to be on the lookout for, different side effects that you might be experiencing, the process of switching medications, and advocating for yourself. I feel like this goes without saying, but I do just want to mention it right off the bat. If you are considering switching a medication or supplement or taking one for the first time, this should always be discussed with your healthcare provider, including your neurologist. This episode is more to bring awareness to you so you know what to be on the lookout for, but I'm not suggesting that you do switch medications or supplements. And even if you are considering it, it must be something that your healthcare team not only approves of, but can also provide more insight and guidance on the best way to go about it. So let's start with talking about the types of MS medications or supplements, because that's where this all starts. Is likely you're already taking something or you're considering taking something and you just want to be proactive and prepare yourself for what to be on the lookout for. So when we're talking about MS medications for managing the disease of MS, those are disease modifying therapies. Disease modifying therapies can be an oral medication, it can be an infusion, it can be injections. There's lots of different mechanisms for these medications, but the goal of all of them is to slow the progression of MS and, if you have relapsing MS, reduce the relapse rates. Examples of disease modifying therapies that you might be aware of are Ocrevus, Aubagio, Mavenclad, Mayzent, and several others. I believe at this point, there's got to be like 25 or more. It's been a while since I've actually totaled the number, but there's a lot. The majority of them are for relapsing MS, but some of them are for progressive MS. Another class of medication for MS are medications to help manage symptoms, not necessarily the disease process like disease modifying therapies, but symptoms. So as an example, there are medications that you can take for fatigue, for numbness and tingling, any type of sensory change, for cognition, for spasticity and muscle tightness. So if you're thinking about the symptoms that you have and a medication that would help manage that symptom, those are symptom management medications. And those also fall in the category of this episode today. And lastly, there's supplements. Lots of neurologists have prescribed supplements or recommended supplements to help with symptoms. Some of them are research-based, some of them are not, but they are anecdotally helpful. And some common ones that you might have heard are omega-3 fatty acids, vitamin D, magnesium, and biotin. But there's a ton. So let's say you're taking any of these types of medications and you're wondering if you should switch a medication. These things that I'm about to outline can give you guidance as to if it would be a good idea to consider switching or not. So first and foremost, the first thing that we probably all think of are side effects, regardless of how long you've been taking the medication or supplement. So if you just started and you're noticing side effects that you're not a fan of, that might be a reason to switch. But also consider that even if you've been taking a medication or supplement for years and years and years, you might not have noticed side effects initially, but you are now. Things change, our bodies change. And so if you're now feeling some side effects, that could be a reason to change. And we're going to talk about side effects in a bit here. But before we do, I want to go into a few other reasons that you might consider switching. Next up is simply you feel it's not helping you anymore, even if it used to. And this requires a lot of self-awareness and checking in with your body, especially if the medication or supplement was something that you thought was helping initially. Check in with yourself. Is it still helping? Is the symptom that it used to help with still at bay or not worsening? Or is it getting worse? Those are things to keep in the back of your mind that can help you determine if switching is a good idea or not. Lack of efficacy is another one, especially when combined with newer research. There is constantly newer research coming out, especially this day and age. I feel like I'm reading an article every month with a new disease modifying therapy or medication or supplement that has now been shown to be helpful with MS or is in clinical trial. So if there's less efficacy for the current medication or supplement you're taking, you might want to switch to something that is more effective. Other considerations might be changes in your MRI results. If you are thinking about getting pregnant at some point in the near future, development of antibodies to current medications, new safety concerns for a particular medication, and overall, just how you're feeling. You know your body best. So as I mentioned, check in with your body and see how it's feeling. And this doesn't need to be daily. It could be monthly, it could be quarterly, or even just once a year. But go through the medications or supplements that you're taking and ask yourself, do you feel that this is still helping? And if there's any reason you're thinking about switching, write that down so that you are aware of it and start looking for some more indicators. So, specific indicators to watch for that might help you make your decision on if switching is a good idea are things like increased frequency of relapses or worsened symptoms, or increased severity of relapses or worsened symptoms. If your symptoms are worsening more frequently, or if when they worsen, they're more severe, that's a pretty big indicator that you might want to switch the medication or supplement that you're on. New or worsening symptoms is also an indicator, especially if it's a new symptom. A new symptom is generally in alignment with progression of the disease. A worsened symptom of a symptom you've experienced before is more often than not a pseudo relapse or a pseudo exacerbation, meaning there's generally not a new progression of MS, but more so something that is causing your symptom to worsen. And this could be things like heat intolerance, like your core temperature is rising, or the temperature outside. It could be due to stress. It could be due to a urinary tract infection or any infection for that matter. So if any new or worsened symptoms are occurring, that might be an indicator that switching is a good idea. If you feel that your disease is progressing, it's not just a worsened symptom, but your EDSS score is changing and you are noticing physical limitations or even cognitive limitations throughout your day that never used to exist. And they've been happening for a while, so much so that your day-to-day life is changing. That could be another reason you switch. Fatigue levels is another big one. Fatigue is one of the most common symptoms in multiple sclerosis, and lots of things affect our fatigue. So it's often hard to pinpoint what might be affecting the fatigue. But if you're taking a medication for fatigue and it's just not helping much, or it's making your fatigue worse, maybe you're taking a medication or supplement for a completely other symptom, but it's making your fatigue worse, that might be another indicator that you could switch because we need energy. And you know better than anyone else how much energy you need to go throughout your day feeling not even your best, just feeling like you have the energy to do the things that you need to do. So if something is affecting that and making it even worse, that's a big red flag. And another indicator, this one sounds kind of obvious, but it's always good to mention so it's on your radar, is changes in your MRI. Does your MRI show new lesions or enlarging lesions? This could be a sign, especially if you are on a disease modifying therapy, that the disease modifying therapy you're on isn't working as well as it used to. And maybe there is a different medication that is more effective. With that said, there are side effects to all medications and even supplements too. But when we're talking about disease modifying therapies and even other medications, we want to think about the side effects, such as persistent flu symptoms, injection site reactions. If you are taking a disease modifying therapy that requires injecting it in you, liver function abnormalities, changes in blood cell counts, mood changes, or depression. All of these are very common side effects for disease modifying therapies that may warrant a switch. And as I mentioned before, you may have been on this disease modifying therapy for a while with very few or no side effects, but now you are noticing side effects. So keep that on your radar. And if you are noticing something, write it down so it's in the forefront of your mind and talk to your neurologist about the possibility of switching. Now, let's talk about proof. My patients talk to me about what they're dealing with, what they're going through, and they say, I think my walking is worse, or I think my fatigue is worse, or my memory is worse. I'm not really sure, but I think so. Maybe it's from my medication. And that brings me to my point of get proof if and when possible. And the way that you get proof is by monitoring your symptoms, monitor and track the things that you're hoping your medications will help with. This is a little tricky when we're talking about disease modifying therapies because disease modifying therapies are not designed to help with specific symptoms. So you'll never see, or at least at this point to date, you will never see something that says this disease modifying therapy will improve your walking or will improve your flexibility. So with disease modifying therapies, the way that you measure progress and monitor and track is via MRIs. But when it comes to other symptom management medications, like medications that help with your walking and spasticity, etc., then you should be tracking your walking and your spasticity and energy and cognition. And I actually have a podcast episode. It's episode number 111, where I talk about how to track your progress at home. And actually, I also have an app called the MSing Link app. And in there, I mentioned the 6 best tests that you can use at home to track your walking, your energy, your strength, your balance, etc. So definitely check that out if you are looking for resources on monitoring and tracking. Using those types of tests, whether you do them at home or with your physical therapist in person or with your neurologist, is one of the best ways to see actual proof of maintenance or regression or even improvement. So make sure that you feel confident in what is happening in your body. And that can be really hard with MS because every day is different. And oftentimes, hour by hour, even minute by minute, can be different. But having that data that can serve as proof of what is happening can be really important. A lot of my MSing Link members will actually track on a monthly basis and they keep their results on hand and they track their results month by month so that they can see the highs and the lows. Again, since MS is different for everyone and even the same person day by day, you wouldn't want to base your decision to switch a medication based on one round of your tests. If you tested your strength and it was way worse, or you tested your walking and it was way worse, if it's just that one time, that's, in my opinion, not enough proof to make an actual change. But If you've tracked it for the last 6 months and every month it's going down little by little, that might be a reason to change. However, if it goes down one month and then up another month and then maybe down a little bit, but not as far as the previous month, that fluctuation maybe could be a reason for switching, but maybe not. That's something that you'd want to talk about with your healthcare team. So let's say with this information, you've decided with your healthcare team that, yes, I want to switch medications or switch supplements or try something new. One thing you need to be aware of is the process for stopping a medication and switching medications. More often than not, you may need to slowly reduce the frequency and maybe even the dose of the medication before switching, not just quitting cold turkey. And so we need to decide based on what medication it is that you're thinking about switching off of or switching to, what the process is to do it safest so that you don't have side effects or worsened symptoms between the phases of switching. If you are taking a disease modifying therapy, and specifically Ocrevus, there is something that occurs that's called the crap gap. And the crap gap is essentially when you are leading up to your next infusion. So the medication, the Ocrevus, is not as abundant in your body as it was when you first got it. So it's getting less and less over time as you approach your next infusion. And because it's not as abundant in your body, you're noticing worsened symptoms and it feels really crappy. You might feel more fatigue, or you might be tripping more, or cognitive confusion, or any of your symptoms really can worsen during the crap gap. And for some people, the crap gap occurs for about 2 weeks before their next infusion. For other people, it might be a month. For others, I do know some people where it's about 2 months before. So this is a perfect example of talking to your healthcare team and deciding what the best course of action for you would be. Do you need to have the same disease modifying therapy, but just change the frequency? Do you switch the disease modifying therapy or medication or supplement, but give yourself time to wean off of it? What is going to be the best approach for you, your body, your lifestyle, your energy, and the symptoms or the reason that you're thinking about switching? Therefore, communicating with your healthcare team is vitally important. And your healthcare team will likely include your neurologist, and it might also include someone who is tracking your progress with you or giving you exercises for your symptoms. So, as an example, there's a medication that can help with your walking. You might also be going to physical therapy to help with your walking. So, if you're considering switching on or off of that medication, you for sure want to be in contact with your neurologist and your physical therapist because they're going to have a more well-rounded view of what might actually be going on, where it's the three of you talking versus just one making the decision. And no information is insignificant. So even if it's just something small that you're noticing, write it down and then mention it at your next appointment. Lastly, I just want to remind you that you are your best advocate. And there are a lot of amazing neurologists and healthcare providers and clinicians out there. But unfortunately, not all of them are going to listen to you. I hate to say that out loud. It sounds so awful, but I know you know what I'm talking about. Not all people with MS who are working with MS neurologists or anyone on their healthcare team are in a situation where they feel heard and seen and respected. And if that's the case, you need to advocate for yourself even harder. So if you feel a difference, but your healthcare team isn't really on board, they don't really understand, then maybe you get a second opinion. Maybe you get a second opinion specifically from someone who you think might listen to you more and take you seriously. And Everyone is going to be different. Every neurologist is different. Every physical therapist is different. So listen to your body. You are your best advocate. You know what you are feeling. No one else can know that. And so I hope you can feel power in that and be able to communicate that to your healthcare team so that everyone can be on the same page and you get the best care that you deserve. If you are interested in having conversations like this, as I mentioned earlier, we have a lot of conversations like this in my MSing Link accountability group, which is for all of the members in my online membership program. And it's not just about disease modifying therapies or medications or supplements, it's everything. They share their wins, they share their struggles. Someone was recently starting a medication and she wanted to know what to do to prepare and what to do to bring with her for her infusion. And we had 50 comments from people saying, oh, do this. This is what I do. So whether you're taking a medication approach or a more holistic route, there's so much support and community and guidance in there for you. So if you are a MSing Link member, I would highly encourage you to join our accountability group. If you're not a MSing Link member, I do have a separate Facebook page. It's not as robust as our MSing Link one, but it's definitely a great resource for you for community and questions amongst each other. And that is on Facebook, of course, called Multiple Sclerosis Wellness and Support with Dr. Gretchen Hawley. And as I mentioned earlier, I do have an app called the MSing Link, and there are chat options in there where you can communicate with other app users. Again, with the purpose of introducing yourself and also asking questions, sharing your wins. So there's lots of resources for you if you do want to further this discussion.